It's funny, Grant, when I brought this to you a couple of years ago, the first thing you brought to my attention was this Coolsculpting study you did. And you know the numbers better, but it was, obviously you're treating tons of Coolsculpting patients, and the number is maybe 63% of these patients had never been to your practice.
Correct.
And even a bigger number had never done a medical aesthetic procedure. Correct. In the past. So that's close, right?
That's very close. We wrote that up in August 2013 in the Aesthetic Surgery Journal, and I think it was 63% had never been in the practice, and a much larger number had never had an aesthetic procedure ever. So they were totally neophytes. It's like they were dropped off of Mars or something, right. And they had no idea what I did for a living.
Sure.
It was crazy. And the interesting thing is when we kept them in the practice and took care of them and provided the non-surgical body contouring, 40% of them were still in my practice 3 years later. That means it was a very sticky phenomena. Sure. They came in, they had their services, and when we looked retrospectively 3 years later, 40% were still coming in for facials, hydrofacials, injectables, lasers, and all the various other things. And over 20% of them had surgery, which again speaks to the fact that these non-surgical services in the aesthetic business can be strong and powerful attractants that then morph into surgery for the plastic surgeons and so forth. So, and education is the key. And FriendMedia certainly goes a long ways towards educating them. They sit there hooked up to their Coolsculpting machines for 1 to 2 to 3 hours even, and they're reading their phones and their iPads and all the rest, but they have these moving images on the wall, and they watch the information that you and industry have provided for them at my discretion, because I get to pick what it is. Sure. And it's been a fabulous method of converting and cross-selling and upselling, and I applaud your efforts. I wish you the very best.
Yeah, thank you.